Alberta Health Services. Healthy Albertans, healthy communities, together.
Good morning, everyone. Good morning, board members, and good morning, any other individuals who are dialing in. And good morning, members of our management team. I am David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to dial in and join us. This will be a short meeting as we have only one motion to consider. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask those in favor, and then I will ask for those opposing or abstaining. If none are in the latter group, I will declare the motion passed. Firstly, may I ask the Corporate Secretary to confirm that proper notice has been given for this meeting and that we have quorum?
I so confirm.
Thank you. May I ask someone to move the approval of the agenda?
Hugh Somerville.
Thank you. And a seconder?
Heidi Overgaard.
Thank you. Does anyone have a conflict of interest that they would like to declare at this time? Hearing none, we will proceed. I will ask that Dr. Brenda Hemmelgarn, Chair of the Community Engagement Committee, the committee that oversees the foundations, to read and move the motion.
Thank you. On October 23, 2019, the board members of the Alberta Cancer Foundation voted to amend a provision of their bylaws relating to the appointment of the board chair. ACF is an established foundation, so any amendment to its bylaws is required to be approved by the AHS board and then submitted to the Minister of Health for approval. The amendment will be effective upon ministerial approval. In addition, on October 23, 2019, the board members of ACF voted to appoint a trustee as board chair, subject to AHS and the Minister of Health, waiving the condition that the individual serve 12 months as trustee of ACF prior to such appointment. Once minister approval of the waiver is obtained, the name of the individual will be made public on the ACF website. The AHS board has considered the amendment to the bylaws and the proposed appointment of the board chair and supports both. Accordingly, I move that the Alberta Health Services Board A, approve the proposed amendment to the bylaws for the Alberta Cancer Foundation as reviewed by the Alberta Health Services Board, and direct the board chair to sign the amended bylaws on behalf of AHS and direct management to forward the same to the Minister of Health for approval, and B, waive the requirement under the Alberta Cancer Foundation bylaws for the proposed board chair having served 12 months as trustee prior to board appointment. I so move.
Thank you. May I have a seconder?
David Carpenter.
Thank you. All in favor of the motion?
Aye.
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 Aye. Aye.
Any opposed? My apologies. Any opposed or abstentions? The motion is carried. We have reached the end of our agenda. I declare the meeting is adjourned. Thank you again for joining us, and have a good day.
Good day.
Good day.
Together, we do amazing things every day.